Welcome to the Shift Report, the podcast from MCentric and the MCentric Foundation. MCentric is the go-to information and resources hub designed exclusively for the emergency medicine community. We regularly host key leaders from the field who share their insights and experience. Our goal is to inform our listeners and to encourage you to use what you learn to improve your practice and improve yourself. To learn more, please visit us at mcentric.org. Today's episode is sponsored by Lotus Clinician Wellbeing. Lotus Clinician Wellbeing provides consulting services designed to prioritize clinician wellness in order to provide the best care for their patients. Lotus Clinician Wellbeing supports healthcare professionals with personalized coaching and consulting services for groups and individuals in areas such as career development, leadership, burnout prevention, practice management, and more. For more information, visit lotusclinicianwellbeing.com. Today, we welcome Gina Siddiqui. Dr. Siddiqui lives and works in the Washington, D.C. area. Beyond her clinical work, she's been involved early on in entrepreneurship and now has founded Carte Clinics. Today, she'll share with us how she has expanded her professional scope, what she's learned along the way, and where Carte Clinics is headed. Welcome, Gina.
Thank you so much for having me.
Thanks for taking the time to talk with us. I think you've got a fascinating story to tell and something we can all learn from. So thanks for taking a few minutes to speak with us. I'd like to start out, as we do with others, is how you got where you are. You practice emergency medicine, you trained in emergency medicine. How'd you end up in emergency medicine?
Well, to be honest, basically fell ass backwards into emergency medicine. In med school, thought I basically was teed up actually to go into cardiac surgery. I did all these rotations, focused on that, and left. I took leave from medical school to start a company at the end of my third year, so right before fourth year, because I kind of had like a, moment of realization that medical school actually doesn't teach you all of the things that I thought medical school was going to teach you. I went into med school thinking I want to make the system better. I want to, change some of these things that are unfair for patients and, innovate. And for some reason, I thought that you're going to learn that in med school, which of course you don't. And I was like, there's 1 year left. And everyone told me, fourth year, you basically just spend applying to residency. So I paused and I looked at MBA programs. I looked at Masters in Public Health programs, all the grad schools. And then this opportunity came up to co-found a company. And I thought that would be a great way for me to learn how to innovate in healthcare. And so anyways, I left med school to start this company in San Francisco. And through that process of, being with founders, being with doctors who didn't just work in academic institutions, which is mostly what I was exposed to, in med school, being with people in private practice, being with doctors who had then become members of the C-suite in their hospital or insurance companies. I just kind of had a broader view of like your career, and I just kind of was staring down the barrel of what, training and a career as a cardiac surgeon would be, and, how much I cared about doing a good job and how many hours that would take, and I just kind of reflected on the flexibility in life that was really important to me to be able to sort of pounce on a new opportunity or a new passion that I had. I thought about my family that I wanted to have sometime in the future. And I just realized that I wanted to choose a specialty where I had more control and kind of could dial things up and down. And, how they say that like you can't connect the dots moving forward, you can only connect the dots when you look back. When I think back, like the rotations that I did the best in actually were emergency medicine. Like that's where I vibed with the people and, they were all like, this comes very naturally to you. And the honors, then, like, I don't know if you remember in med school, all the like high pass, honors, blah, blah.
Well, I remember med school and I remember, I do remember.
That's where it came most effortlessly to me, most naturally. And, at the time, I actually vividly remember a conversation after my emergency medicine rotation with two other students, like two other who are still good friends with me now. And one is an EM doc and one is an internal medicine doc. And the three of us were talking after like a rotation. And we're like, oh, like, would you ever go into EM? And the guy who is now an EM doc, who's an amazing EM doc, by the way, you should interview him for the podcast sometime. He was like, yeah, this is great, and he talked about all the things that are wonderful about it, like how you're really participating in diagnosis and how you build rapport with people so quickly and how you, are collaborating with every piece of the healthcare system. And then also the career flexibility and all the, practical benefits of EM. And then the IM doctor was like, yeah, but like, you'll never be famous. Like no one ever will seek you out as like, oh, I'm going to see this doctor, right? Because it's just going to whoever in EM. And I just remember kind of hearing the two of them and I was kind of quiet, just listening to them talk. And, those are real trade-offs going into our specialty. It's an unsung hero. You're not going to be, there's still no like top doctors list for EM, right? But we know who the really good doctors are. So anyways, I came back from my time away and that friend who went into emergency medicine is a big reason that I revisited and did the away rotations. My parents like still thank him for like saving my life and me not going into cardiac surgery. And yeah, the rest is history.
That's a great story. And I think maybe we'll come back to part of that, which is fascinating, which is the willingness to stop medical school at some point in the middle, take a break to explore something else and come back, which not many people do or even think they can do. Or if you brought to them the idea of doing it, they would think you were crazy. So that's an interesting way to explore other things to do, which has probably also assisted in your exploration of other things now. It's you don't meet many people who did that and did it successfully. So congratulations on that.
I mean, I don't want to take too much credit because I think plenty of people do it to get an MBA or to get an MPH or, like in some program, that has a label on a stamp that they get at the end. And, I think that we're doctors. We have a lot of fancy stamps after our names already, so we're able to, if we want, just kind of, do something with the stamp for a
Go
little
look
while.
around. That's
Yeah.
great. Now, you eventually went into emergency medicine and graduated from residency and pretty quickly started to explore other things and still practice clinically. It's not like you left clinical practice, but started to explore other things. What were some of the early things you did at a more system level and then at an entrepreneurial level?
Yeah. So I was pretty heads down during residency. I know some people, they start companies while they're in training or they have like a lot of things they do on the side. And just candidly, I felt like I needed to put in the time to really understand how to, you know, do the job well during residency. So I was pretty focused on that and then just being sort of happy outside of that, like taking care of myself. I got married during residency. Um, and then, yeah, the first job that I took out of residency it was during COVID. It was 2020. Was with New York City Health and Hospitals. They're a big public hospital system. I think they're the largest public hospital system in the U.S. And they wanted help from young doctors who wanted to sort of dedicate part of their time to the kind of administrative system response. So I was, I guess, 70-30 split, 70% admin and 30% clinical. I worked at Elmhurst. That was my first ER job. And in my admin time, I learned a lot about how a integrated system, that has managed care, that has insurance, it has an ACO, has, post-acute care, has primary care, outpatient facilities, how such a cradle to grave system puts all the pieces together. And that was totally fascinating to me. I always wondered, like, the people who we see in a revolving door system in the ER, what we can do outside of the ER to support them, and how we can sort of fix the broken links in the chain that we can address on our shift. So I kind of always knew that was something I was passionate about, and that experience cemented that for me. And then after that, during that year, I also applied to business school and thought about going to Harvard Business School. I actually put my deposit down when my son was just like a few months old. And at the same time, again, something sort of just fell out of the universe into my lap. A friend was starting a company. At the time it was called Florence. It's now known as Fabric. that was hoping to make the hospital of the future. That was the idea as it was being
Mhm.
incubated at a VC fund in New York. And the problem that they were seeing was that a bunch of technology solutions were sort of addressing one little part of the patient experience when they worked with the health system, and nobody was really going across a continuum of care. So I was the first doctor on the team. It was a bunch of technologists and me. And our first product was actually something in the emergency department that we deployed to help what I'm sure every listener on this call can identify happens at their shop, which is there's a lot of wasted steps by nurses and staff entering data that actually the patient could do. So we tried to essentially open up part of the EMR to the patients, and the company's doing really well now. They've raised $60 million plus and serve, I think, more than 1 million lives in the United States. And yeah, they're just crushing it.
Yeah, that's a great story. And I think we all, as we're working in the clinical system in which we work, just sort of accept the inefficiencies and sometimes throw our hands up, but also become pretty good at troubleshooting them, jerry-rigging things to make them work, figuring out ways around the system, or just complaining to the patients that, nothing works for me either. Um, so that company that's an admirable goal, and that's an amount of money. That's an important amount of money to raise, and also speaks to their legitimacy in the business world to get that kind of raise. Now you are working on something called Carte Clinics. Tell us what that does and what the idea is, and a bit about what you're doing with it now.
Sure. So I think just to frame it in terms of previous companies and
Mhm.
how this one feels different to me, the other two companies that I was part of the founding team for were technology companies. There was a very heavy emphasis from the beginning, like the MVP, on some technology tool. And I think it's so important if you decide you want to start a technology company to think about your team and how you fit into that team. And if you have the other technology pieces, if you're not a technologist yourself, which I'm not, I wasn't the engineer building either of those.
I'm going to interrupt you for 1 second. MVP is not most valuable player,
Oh,
but it's an important acronym for people who want to go into business. Why don't you explain that a little bit?
sure. So the
Minimum viable product, usually.
Exactly. Yes. So whenever you are going to try to test some new idea and see what resonance it has in the marketplace with customers, you want to try to come to some clarity on whether it's working or not working quickly. And so you usually don't make it perfect and invest a lot of money to ask the first question about is it good or is it not? In fact, first, you probably don't want, if you want to make anything, you just want to sort of talk to people about it and just understand what their problems are and what they need. But anyways, if the thing you're selling that you're hoping to eventually get paid for involves technology and you're not the person making the tech, exactly at that point in your business, you need to think about who is the technology person who is going to deliver the tech and how am I going to get them? And, like, how are the two of us going to accomplish this? Like, can you get to that step successfully or not? What are your prospects? And I think a key part of Fabric's success is that the technology piece was rock solid, right? So I knew coming into that the clinical input that I had about those problems in the ER that all of us can speak to, I knew that I was translating them to a team that was going to be able to do the parts that I couldn't do. So you have to sort of feel like you're teaming up with the right people. So anyways, the previous two companies were technology companies, and Carte Clinics, which I'm the CEO of and the solo founder, is something that is not a technology company first. It's a healthcare services company first. So I thought about what is needed for the MVP, for the first thing that customers are going to use, and can I deliver that? Do I need anyone else to do that if I'm planning on being the sole founder for this? And I said, no, actually, I can do it all. So, okay, that's a viable thing to start.
Good
So,
start.
so what Carte Clinics does is we are the first call for people for any health-related question. And we help them with their health-related questions by building a medical expert panel that is matched to what their needs for expertise in healthcare and medicine are. So to unpack that a little bit, we have people with, all different backgrounds, all different levels of how healthy or sick they are. And everybody, right, has needs in their health that are kind of going unaddressed or that they want to do better with, right? And for each of those people, there's a different type of medical or health related expertise that could shed some light on how to unlock that. So we have some people, for example, who are dealing with a serious diagnosis like a cancer or an impending surgery. And for those people, the key medical experts that we bring into play are people who have expertise in that type of cancer or that type of surgery. For other people who are really healthy and are thinking more of a preventative lens, the types of expertise they might need might be more on the technology side for like which monitoring devices or which new tools that are out there on the market right now are really going to move the needle for the types of things that they want to do. So we basically do a lot of research, build a custom panel from our like now growing team of doctors who work for us. And then we coach those patients with a very rich repository of medical records and data on them on week by week what to do to get better. And a big part of that, and what was sort of the beginning of genesis of the company, is finding who the right in-person doctors are to take care of them. So we vet and do much deeper research on specialists, facilities, testing, than you would get basically by Google searching or by just like asking your primary who to refer you to.
It's certainly a great service. There's a navigation aspect to that. Even people with medical expertise, have trouble finding, if you just take the population of people who have a serious illness, finding the right specialist or the right series of specialists to help to manage that illness is difficult. We all have
Yeah.
friends, colleagues who have either themselves or had a family member suffering a form of cancer or something, and you hear the story of them searching around and they sometimes can't find the right thing, or they have take weeks or months trying to find it. I'm not going to ask you to give up the secret sauce, but how do you find people who have that expertise? How do you match them with customers? I assume there's a money flow aspect to this at some point. How does all that work?
Yeah. Well, first of all, you're absolutely right. It's like it is a problem even for doctors. And we have clients who are doctors or who are doctors who are taking care of their family members because, like you said, it's like even for the insiders, which we are, it's incredibly opaque and difficult. And I think that the part of the reason that I wanted to start this company actually was how bad a job I felt like I was doing when I was getting those calls, right? Like we all get these calls. And I was just thinking to myself, well, Jesus, like I don't know who the expert for this is in Albuquerque, New Mexico. Like I just totally don't. And obviously you all, like everyone, all of the people listening to this, we get these calls after a shift on the weekend. Like we don't have the time or the directory to solve this for the person who's calling us and who's trusting us and who needs us in that moment. So, the way you solve it first and foremost is not anything complicated. It's just having the time to do it. And then, we start to build momentum, right? The more that we've done this, the more research in different domains that we've done, the easier it is each incremental next client that we're doing research for. So it started in a very humble way where, essentially like I talk to my colleagues and friends about who is the person you actually like referring to and asking questions to in X specialty, right? And then we augmented that with some data sources. You can get a lot of outcomes data on providers from claims, and there are companies that focus on this. They don't do it primarily patient facing. They actually do it for people who are trying to like buy practices or, things like that. But the data is there. And then we try to tap this latent resource of nurses, right? Nurses know a lot about the doctors they work for, the doctors they scrub in with, they just know a lot of that. And a lot of that that information isn't attainable any other way. So yeah, we just basically started building like a directory that we started to enrich and enhance with previous referrals we made to those places. And the like guiding light for me has always been Michelin. Funny enough, like the restaurant guide. And
Mm-hmm.
I just like that you don't become a Michelin restaurant by like checking off a checklist of like, oh, these are
Right.
the ingredients that you offer and these are the hours that you're open, right? Like that's absurd. Like the thing about a special restaurant that you feel is you walk in and there's some je ne sais quoi, right? About how
Right.
all of the intangible pieces come together. And although there is hard data for good doctors, a lot of what makes a good doctor is that je ne sais quoi, like they listen and they're thoughtful and they have a spine to stand up to the patient if they're saying something that's not right, and they take the more difficult route if they need to, and they tailor their plan to what the person is likely to do, and they read up on stuff, and there's just all this stuff, right? And the delta between a mediocre doctor and that exceptional doctor is crazy, right? Like
Mhm.
all of us doctors know there's bell curves among doctors in every specialty as well. So once we find those people, we just hang on to them and we ask to work with them. And you're right, we do pay them for their time when they offer us their opinions, but you cannot pay us to be one of the doctors we refer to. We
Right.
think that would compromise our, impartiality.
Yeah, you can't advertise with Carte Clinics and then suddenly be their best doctor. That's a good
Exactly.
thing.
Exactly. No like referral kickbacks or none of that, obviously.
That's very good. So you have more than an average amount, much more than an average amount of expertise at starting a business and going into ventures. You've done it now a couple of times. I'm sure that there have been things in either Cart Clinics or one of the last couple of things that haven't gone so well that you've learned from that a budding entrepreneur could probably use a lesson on. What are a couple of things that you've learned along the way? If you're an emergency physician who's listening to this and says, I'd really like to start a business, either building a device or working with some software executives or something, what are some things that people should look for?
Yeah. I mean, to be totally honest, I think that more doctors need to be told to go for it than like, you're not ready, or, it's harder than you think, or any of that. I mean, of course, yeah, it's hard. And you're gonna feel stupid a lot. But I think that in general, as a community, we're very conservative, right? Like we're used to having, a lot of job security and a lot of financial security, and what's the graduation rate from med school, and like we've just done a lot of successes one after another, and I think that we're pretty risk averse. So I think if you look inside yourself and you feel that you're open to taking on that risk, I think that actually that's the biggest barrier to overcome. I mean, I know for me it was that I was afraid to start this company, and I didn't know if I was gonna, I would have no one to blame for its failure other than myself, right? And I didn't know if I was ready for that kind of radical honesty. And as soon as I was, I mean, it really was not, that was the hardest part. That was definitely the worst thing, was just learning how to face your fear. And then, if you made the bed, right, then you have to sleep in it. That's it.
That, that's another life lesson. I guess if you made the bed, you have to sleep in it. So and you and I we haven't really known each other particularly long, but we've run to some of the same circles as far as conferences and meetings and
Yeah.
things. And particularly some of your prior ventures, you mentioned working with technology and software developers and otherwise, and being the doctor they sought. And for people who don't know the technology industry and the medical device industry, it tends to be a lot of people who aren't medical who think they can do something medical, and then they at some point reach out to a doctor. Many doctors probably think they have to have a lot of expertise to jump into that. I have a feeling you think you don't necessarily. What's some advice for people who may get approached by an innovative idea or technology or something and need to be the medical advice for that?
Well, I think actually there is a lot of expertise and delta between the doctors that are good at doing that and the doctors that are not. And it's different than being just a good clinician.
Right.
There's like, the cliche that technologists and doctors, clinicians, not just doctors, are like oil and water,
Mhm.
and there's always this, tension and push and pull in a company that needs both of those on how they will work well together. So I think that to be an effective clinician on that team, you do need to have some curiosity and humility to like understanding the perspective of the engineering side or of the business side, instead of sort of just vilifying them. It's like, oh, they're not doing what's right for patients, or they don't really understand. Yeah, they don't understand, just like we don't
Right.
understand everything about their side. And it's like our job together to understand, So I think it's totally a skill set and something that, every rep you put in and try to be involved in those circles and lean into those opportunities, you get differentially, better and better at that and more of an asset to your future endeavors that require that skill, that muscle. But yeah, I think being humble and being intellectually curious about the other side and how to, build a product and bring it to market is pretty critical. Like you're not going to succeed, I think, by just being an excellent doctor, which is obviously hard enough, right? Like it takes decades to be a good doctor.
That strikes me as that's reminiscent of things that I've heard people say, and I've probably said to people over time, which is you get in a situation like that. And as a doctor, we're not in charge of everything, but we're used to being in charge, or at least the
Right.
highest person in the room, whatever room we're in.
Yeah.
You get in that room, you're not necessarily in charge. There's a CEO who may not be you. In your case, it is you. There's a CEO, however, who may not be you, who's answering to a board,
Right.
who's got a lot of money riding on this probably. But you do, even though you're not in charge, you have to be helpful and bring up your expertise when it's needed, because you can also keep that CEO out of trouble.
Exactly.
That's
Exactly. I was going to say that, in some domains, you are totally in charge, and you should feel in charge and you should feel that sense of responsibility that like, I am the most knowledgeable person in the room on this topic. And like the buck stops with me and I need to be firm about these things. And I think those are the best CMOs, chief medical officers, the best, even clinician advisors who aren't, involved in the day-to-day operations are the ones who know when they should put their foot down and be really, firm about a principle. But yeah, it's a great point. I think that, doctors, a lot of times they actually undersell their abilities and their skills. And, the first time you get reached out to for one of these consulting things, they're probably going to ask to take you out to dinner and they're going to expect to get it all for free, like basically for the price of dinner. And you can name your
right.
consulting rate. And I've told my doctor friends, like, it should basically start at $500 an hour. It should be that or higher. So just peg it to that. And then, if they
Yeah.
don't take you seriously with that, just move on.
You and I have had similar conversations with our colleagues who we are, we're used to giving our expertise away, sometimes for the right reason. That
Yeah, there's a time and place for that, for
nothing
sure.
wrong with charities and
Yeah,
nothing wrong with free clinics and helping people in need.
100%.
But for-profit companies are not people in need. And, you do hear, well, we'll pay you when we have revenue.
Yeah, yeah.
Well, you're paying your lawyer now. How about paying
Right.
me? Yeah.
Right. And actually, I will give the converse of that also, which is, if a pharma company is knocking on your door, they can pay you, right? But I also think that there's plenty of space and it's appropriate and sometimes the smart thing for you even to do stuff for free for startups. And the reason for that is, first of all, startups really don't have a lot of money to pay. You're right. They may pay their lawyer because they have no alternative, but they can pay you in something else, which is very valuable to you, right? Which is experience and exposure and possibly equity.
Right.
And it may be smart for you to do some of that work for free. They always say that you should do the job you want for free for a little while, right? To get that job, to justify that you'd be really good at it. And I think if you're consulting on your area of clinical expertise, start at $500 an hour and be firm on that. But if you're trying to like learn about product development or technology or be part of a team and you really want to make this part of your career, recognize that you're kind of like, how I was either going to pay for an MBA or I was going to do this. So those people, they're giving me something super valuable that like otherwise I was going to pay a lot of money for. So I think recognize also that when you're investing in yourself and training yourself, you may go unpaid for a little while. I have seen the opposite. So I've seen my colleagues who don't negotiate for, consulting fees, but I've also seen my colleagues who expect totally unreasonable starting salaries at startups that are supposed to match their clinical salaries. And like, if you're doing a job as a doctor on a like if you're doing something product related or being a co-founder, they're not going to pay you what you're going to be paid at the hospital. And
Right.
you're taking a bet on something different. So I think you have to think about the long-term value to you and that you're going to look on your back on your deathbed. I mean, I think about that a lot. And what is that you want to have experienced in your life? And for me, the money that I'm foregoing for the shifts I'm not working in the ER, but that I'm getting to travel, that I'm getting to meet these really interesting clients and patients, that I'm getting to recruit these doctors who just like blow me away with their knowledge, that's worth way more than what I would be paid on that shift. And I did not pay myself the first year of this company, $0 for all the hours I put in.
Right. So speaking of the company, so what's next for Carte Clinics? Where do you see it headed? Where would you, I'm not going to ask you 5 or 10 years, but sort of what are the next things for growth for Carte Clinics?
Yeah. My vision is that any person in the US of A who has medical problems, medical questions that they feel are going unanswered, that right now they don't have a place to go. I want there to be an infrastructure for those questions to be answered. And I think that infrastructure should be filled by doctors. Doctors today have this crisis. I mean, not to make it sound more extreme than it is, but I think it's a crisis where we don't feel a sense of satisfaction from our work because so much of our work is tied to an employer who isn't focused on the patient, right? The way we are. And doctors are losing their respect, their trust from the public because all of their contributions to society are gated by that employer. And I think that Carte Clinics is just one company that's part of a movement that is putting the patient and the doctor back together with each other to focus on the things that are most important for health. So what I want to do for my parents is I want to have a relationship with, a medical expert team, like Carte Clinics offers, who I am paying, right? Who have accountability to me, right? Not to the insurance company, not to their employer, but to me, and who I know are focused first and foremost on the right outcomes, my parents being better. So I think that there's a future world in which, more Americans invest part of their budget for their health and wellness to a doctor-led team of medical experts who coordinate and manage the outcomes for either themselves, their family members, and so on. And, I think that that's essentially like a new specialty or a new side, a new kind of percent of work time spent for every doctor, every clinician in America who wants to do that. And from my experience, as we've been interviewing for our company, there are so many doctors who are starving for some time like that, right? That is not time that's unfettered. They can spend as much time as they want on each patient. That is, detailed and focus on frontier stuff, allows them to research. That is judgment-based, that allows them to make opinion-based calls on what they think is the right thing for a patient to do. That is intimate. That's what I went into medicine to do. And, for many years before I started this company, I felt like I was this delusional person who thought like that being a doctor could be these things. And maybe I was just wrong. And I just had to get in line and keep being this kind of doctor that my employer is making me. And it's just not true. We just need a different business model and a different way to do that. And then, doctors can go back to whatever brings them joy with their training and their expertise and their, good instincts for taking care of people.
That's a great way to close, really talking about the business growth that is important, but also you mentioned joy and bringing joy back to what we thought the practice of medicine was and addressing some of the wellness and burnout and other issues that physicians and others face that we're hoping to help with at MCentric. So thank you for that. If people want to find out more about you and Carte Clinics, what's your website? How do they get more information?
Yeah, Carte Clinics is CARTE clinics.com. And then my email is gina@carteclinics.com. I'm on LinkedIn and Twitter and all the things. So
Yes, you are. Yes, you are. So yes, find Gina on LinkedIn and Twitter and various other places also. And thank you, Gina, for taking the time today to share your journey and perspectives on emergency medicine and the work you're doing.
Oh, anytime. Thank you for this amazing platform for other docs on EMcentric. And yeah, I would love to stay involved and just be part of the community.
And thank you for joining us in this installment of our MCentric podcast series, The Shift Report. And special thanks to Dr. Gina Siddiqui for sharing her important insights. For more content, networking, and innovation in the world of emergency medicine, please visit mcentric.org. And another thank you to our sponsor, Lotus Clinician Wellbeing. Learn more at lotusclinicianwellbeing.com.